Hello. Hello, good morning, everybody. My name is Dr Opara, and I welcome you to this special program. In our midst, we have expectant mothers, we have mothers, but we don't have, it's like this program majorly is for mothers. So you're welcome. I'm a dentist, so right now we are going to be talking about oral health. Before I start, how many of us have actually visited the dentist? If you visited the dentist, can I see your hand up? Before? But I don't like us. How many of us have visited the dentist before? Only less than 5. Wow, that's strange. Okay. The thing is, oral health is very important. And as they say, health without oral health is no health at all. If you have good health and your oral health is terrible, then you don't have any health at all. I can imagine you're beautiful, you're well dressed, and you're moving and you have mouth odor. I don't know how that's going to help you. You can't even relate with people. You understand? So oral health is a very, very special aspect of health one should actually look into. So I'm not really pleased that quite a number of people have actually not visited the dentist, even for way of advice or what have you. Okay, so right now I'm going to start. Of myths most of us have here. For example, some people say, I think generally about health really, in this part of the world, people say, when you start going to the hospital, that's when they'll discover this one, discover that one, discover that one. Prevention is better than, prevention is better. If you don't go and you don't run tests or do certain things, and that's why the whites, they live long compared to the blacks or Africans. So, I mean, coming to the clinic, oral health is advocated that at least you should visit your dentist twice yearly. Okay, I can understand this part of the world, okay? A lot of people are hustling for daily bread. At least once a year, if you budget maybe 10 or 15,000 naira in a year for oral health, for your dental, your teeth, is it too much? Is it too much? So there are some myths right now to counter. The myth of some people say if you visit the dentist, if you remove a tooth, that's how you keep removing. How many of you have heard of that myth? Some people say if you remove a tooth, that's how you keep removing, which is very wrong. That myth is very wrong. I used to tell people, they come to the clinic and say, doctor, I say this is very bad, let's take it out. Okay? They say, doctor, they say, if I remove, that's how I'll keep removing, which is wrong. One thing I want to clarify here is that most of the time you come to the clinic, okay, and you do oral check, you notice that, okay, apart from the complaint they came with, maybe a particular tooth, swollen jaw, and what have you, I will have to take that tooth out. Of course, you will not concentrate on that tooth alone because you're already in your clinic. You have to check every other one. And you notice that, okay, this one, there are 1 or 2 cavities or holes. And you say, okay, fine, I'm going to deal with this present one you're coming with. But please, I know you're not prepared for others yet, but make plans for others. Before that, they say, doctor, I've heard. And after dealing with that one, maybe taking out that tooth eventually, you won't see them again until maybe after 2, 3, 4 years. That's those small ones that we discover. They are now big and they now have another swollen jaw. And so now, is it the fault of the dentist or their own fault? It's their own fault. But again, if you look at it, somebody that does not know the true story will say, because this person has removed before, that's why this person is coming to remove. The person did not follow due instructions. Okay? That's one myth. Then another myth about dental is about pregnant women. And thank God we have a lot of pregnant women, expectant mothers. They say, you're pregnant. Just manage it till you give birth. Don't go and see the dentist to manage it. They don't used to take out when you're pregnant. Well, that's another myth I want to counter. Okay? You can visit, when you're pregnant, you can visit your dentist at any time. First trimester, second trimester, third trimester. But in our field, the best. Hello? Hello? Is everybody with me? Yes. Okay, fine. The myth about pregnancy and visiting dental care. Okay, you can, as I said, you can visit the dental office at any time within your pregnancy. But in our own field, dentistry, the best time actually to do intervention is when the lady or the woman is in her second trimester. But that's not to say that even if she's in her first or third, that if it's an emergency, we cannot deal with it. Okay? But if it's not an emergency, if it's something elective, we say, okay, wait till you give birth. Or better still, wait till your second trimester. But if it's an emergency, we deal with it. Okay? That's another myth I want to clear. So now, pregnancy. You find out that during pregnancy, a lot of things, hormonal changes. In my practice, I notice that a lot of pregnant women will come, doctor, this is my teeth, I don't know. Every time I get belly, now this thing they always come. Every last time I get belly, the same problem. She's correct, because the thing is, during pregnancy, there are a lot of hormonal changes, and those hormonal changes disrupt a lot of things, even apart from the oral in our body. You understand? The mouth itself has a lot of bacteria, and now when the hormonal changes due to pregnancy, it will disrupt all these things. Without that, the woman obviously have maybe decreased salivation. You understand? There is decreased salivation. It will lead to a lot of things. It will lead to dry mouth. It will lead to cavity caries. Okay? So hormonal changes. So what I tell them is, during that pregnancy, okay, make sure you keep your oral environment clean. You understand? Morning and night brushing. There are some habits that pregnant people inculcate, okay, that even aggravates these things. Fine, you're pregnant and you already have these hormonal changes disrupting a lot of things. But even your personal lifestyle, there are certain things we do. Pregnant people say, this is just like get belly, everything they hungry me. Any small thing, you don't carry, if you eat this one, finish the next 30 minutes, you're eating this one. So a lot of things like that. For example, in our field, when you're, and again, the pregnant people tend to eat a lot of junks. True, of course. You guys tend to eat a lot of junk. Then in my profession, we even discourage junk eating. Okay, let's assume that you guys will do without eating junk. And then you eat it sparingly. Then you eat it close to meal. Don't eat it in between meal. What that means is, if you're eating, it is maybe during your lunch, you take your junk, eat your junk. After eating your junk, you now eat your lunch. Okay, close to your meal time. But you find out that a lot of people, they will buy drinks, gum diseases, and what have you. And in dealing with that gum disease, I'll answer your question from my own perspective. You talked about preterm babies. I'll deal with that. Okay. So now, dental caries is not really just for expectant mother. It's for everybody. Okay. Dental caries just means cavity. What is cavity? Hole in the mouth. In the hole when your tooth or your teeth has hole. You understand? And what causes this thing? I've mentioned it earlier on. Eating a lot of junk. Then for some people, it's actually hereditary. You understand? In their family, the mother used to have a lot of dental issues. You find out that the children too tend to have that also. You understand? But hole doesn't just come like that. Again, it boils down to our lifestyle, the things we eat. Okay? For cavity or hole to manifest, certain factors has to come into play. What kind of food do you take? Okay? The frequency of how you take it, the timing. You understand? So the mouth already, every part of our body has bacteria. Hope we know that. That's why even the hand has a lot of bacteria. That's why we encourage oral hygiene, we encourage personal hygiene, hand washing and what have you. Okay? So even your mouth too has a lot of bacteria. But the thing is, some of those bacteria are actually bacteria in the body that it's not as if they are harmful. They are also beneficial to you. But certain factors that now come into your oral cavity will now disrupt it. So during pregnancy, apart from the fact that your hormone are disrupting the bacterial, okay, madam, you're sleeping. I will ask you a question. Hello? Hello? Okay, you're getting my story, I think, in the spirit. Okay, so now, a lot of factors that I say are due to dental caries or cavity in the mouth. Okay, when all these things come into play, the junk eating, sweet, and what I mean, refined sugar, which can come in form of chocolate, junk food like donut, cake, and what have you, then the bacteria in the mouth, which again, like I said, will just be normal. But because we have so much sweet thing going into our mouth, those bacteria in our mouth will act upon those sweet things. Then over time, the bacteria will produce acid. And it's those acid that, dissolve the tooth enamel. Because the teeth is a very strong tooth structure. That's why at times, even when something happens and they cannot find any evidence, you understand? Maybe something happened to someone and they try to get evidence, they'll try and get the tooth. From the tooth, they can know a lot about that person. Because find that most times, even when every other part of the body is dissolved or damaged, the tooth is very strong. It's very hard for it to just get dissolved like that. Okay? So, it's very important. So, all these factors actually lead to, over time, lead to breakdown of the tooth enamel, forming holes. Because we find that in the clinic, people come and say, doctor, why is it that every time they get hole, I get hole that time? I say, okay, your lifestyle, apart from oral cavities, other things, you find that lifestyle is very important. Lifestyle is very important. The things you take into your mouth is very important. We have a lot of Muslims here, we have a lot of Christians here. I took time, I looked into the Bible. I found that the mouth and everything that has to do with our mouth was mentioned about almost 400 times. In the Quran, it was mentioned almost 13 times. That means the mouth is very important. If you take time, go through your Quran, just read everything that has to do with the mouth. You find that even the Holy Book encourages us on how to take care of this. Whether by way of the way we talk, control your tongue, control your mouth. You understand? The Bible and the Quran said a lot of things about the mouth. So dental caries come with the things that comes in over time with the bacteria in the mouth, forming holes, dissolving, and getting cavity. Another thing is I will rush you. Another thing is gum disease. Find that during pregnancy, a lot of women have a lot of gum issues, either by bleeding gum. There's what we call pregnancy gingivitis. You understand? There's another one, the thing will just come like a boy, especially during pregnancy, called a pregnancy granuloma. You understand? They're coming to preterm. This bacteria, gum and periodontal. Periodontal means the tooth structure, the support of the tooth structure. Now, if you don't take care of the mouth, research has it that dirt in the mouth, gum issues will actually lead to preterm babies and low weight babies. How come? Apart from preterm and even low weight babies, okay, they could even lead to, for some people, heart related issues. Because the mouth, like I said, has bacteria. Okay? Has bacteria, a lot of bacteria. Now, and when you eat the food and the bacteria mixes, they form what we call plaque. The plaque again is bad bacteria or hardened bacteria over time. And when you have it and you now start having those conditions, they travel. There's a lot of connection between the mouth and every part of the body, between every organ of the body and every part. Don't worry, when I'm done, you ask a specific question. Okay, then I'll relate with you directly. They said I have just 5 minutes. Okay? Then another thing I want to talk about. Okay, fine, especially mothers and everything, when you now give birth, your babies, how do you now take care of them? Especially with their oral cleanliness and everything. You see some people, they so much dogs their children. This one my baby, every time they're kissing their children, this one is my love. Maybe the mother has been looking for a child for a long time, I did not say, God, finally answer the question. So remember I said this data issue will also be transferred. And so when you're doing that, no, my baby, you're indirectly transferring a lot of things to that baby. Hello. Hi. Another thing is, after giving birth again, feeding of the baby. A lot of people. So there's what we call early childhood caries. You see a baby of you wonder, this baby, this so young of age. How come the baby has a lot of holes and what have you? Early childhood caries, early childhood holes. You find mothers, every time, maybe because of disturbance, and mothers are so tired, they don't know how to go about it. They now put filling bottle in the baby's mouth. Oh yeah, take, sleep. So the baby will sleep over the filling bottle with food, or carry breast, put in the baby's mouth. The baby will now sleep, mother will sleep, baby will sleep. You understand? All these things affect the baby's teeth. You understand? Because filling bottle has a lot of sweet stuff, yeah? The milk and what have you, that's the food solution. Over time, remember what I told you, sugar, bacteria in the mouth, over time causes cavity. So over time, from sleeping to the following, you can see the long time, and the baby's mouth is in that, the filling bottle is in the baby's mouth, the baby's mouth is on the breast. Over time, causes a lot of damage to the baby's oral cavity. Hello? So these things are very important. Overall, visit your dentist regularly, at least twice in a year. Or if you are so busy, once a year. Is once a year too much for you to just say, dentist, I've come for checkup? It's not too much now. Once a year, you see us. So let me just take questions. Okay. Any other question? Okay. Any other question? You said when you take cold water, you feel like a shocking sensation. Now, the tooth is divided into 3 layers. We have the outermost part, which we are seeing, which is the milkish white part you're seeing. Apart from that, you have the dentin, you understand? Then now the pulp, which is the innermost part. Now, when you have exposure of that outermost part, you understand? If you take cold water, you don't ordinary water for some people, you tend to have shocking sensation. You understand? So when you're having those shocking sensation, you actually need to see your dentist to actually prescribe one form of toothpaste. At that stage, is that toothpaste which actually solve that problem. The kind of toothpaste will solve it. Then again, if you have cavities, any form of cavities, you understand? So, you know, in every condition, early detection and early intervention is very important. So for some people, they will have a hole. When the hole is not disturbing you, they will wait to on that tooth start giving them headache or they're swelling before they will visit the dentist. No, if you have a hole and food is getting in there, that's the right time to see your dentist for intervention. Okay, that answers your question. Then your question is what causes mouth odor? A lot of things can cause mouth odor. From improper oral hygiene, because ideally you're supposed to brush morning and night. You don't brush morning and night, especially night brushing. Or when you brush, you don't brush the tongue. You understand? Properly. Then again, alignment of the maybe the teeth is not well aligned. You have something that actually not in proper position. You have this one here and that one. So when you eat, you tend to hide in between. You understand? When you go, they don't come out. So over time, people starting food we eat will lead to that bad breath. Okay. Then again, cavities. Somebody has a hole. Also, I see some people. They come to the clinic and say, doctor, for some time now, for a long time, not even some time, I've not been eating with this part of my mouth. If you've not been eating with a particular part of your mouth, death will build over that part. The way God created your mouth, created it so that you can eat with both sides of your mouth. So if you're not eating with one particular side, please visit your dentist to see why and to get solution. Thank you. Thank you so much. So my question, I have 3 questions and 3 gifts. My first question is, what are the materials you need for proper cleanliness of the mouth? If you want to answer, raise your hand. Yes, what do you need for proper cleanliness of the mouth? Remember I said, what are the materials? I need someone to give me.
You need water.
Water.
You need good toothpaste.
Okay.
You need good toothbrush.
Correct. Water, toothpaste, and toothbrush. So this is everybody clap for her, please. So a lot of us are not used to this thing. This is dental floss. What we only know is your toothpaste and your toothbrush. So, but a lot of people use toothpick, high storage toothpick, because when you're using it to pick your mouth, you're creating space between the tooth and the gum. You understand? But instead of that, you use your dental floss. You see this rope part. You understand? You put it in between. You do it once daily. Maybe at night, you now use it for every part. You put it in between 2 teeth and remove that in between the teeth after brushing. Or better still, before brushing, then you brush. Okay, so this dental floss, you buy yourself a dental floss. Any question? My second question. My second question is this. Instead, what are the things we can use to substitute the things that causes cavity? You understand? Instead of taking the things that causes cavity, what else? Especially in children. So instead of giving them the things that causes cavity, that you know that over time will cause hope for them, what are the things you can give them to prevent? Instead of that thing, give them to that thing. Who can answer that question? Something happened there. I answer. She's correct. So instead of those sweet chocolate and water, fruit is very important. Then I hope vegetable. So clap for her, please. So my last question. Hold on. My last question. And this one, what is my name? What is my name?